Hi, it's Jay Johnson again, Joan Johnson from Jay Johnson Education Center. And guess what? We're getting ready to do another skill for you. The skill that we're going to do right now is Peri Care on the resident, on the female. For the state, you would only be doing Peri Care on the female. Now, when we go into the nursing home, if you have a male, I show you again how to do it, and I also show you how to do it here as well. But when we go into the nursing home, I show you how to do it there in case you're unsure. So again, you knock, the individual tells you to come in, you ask them their name, and you also introduce yourself, and you tell them what you are doing, and you always make sure that your bed is locked, okay? So now we're going to be doing Peri Care. I'm gonna raise my bed because I wanna raise the bed. Always remember to raise the bed. And guys, with every skill that you are looking at, please always remember to read the skill. Okay, even though I'm showing you the skill, I need for you to read the skills, and also understand that the skills are not order dependent. There are some things that you do before and you do after, and I will explain those things in another video. But I just want you to understand that because students get confused about whether they should give the call light with gloves on or whether they should not. Remember, that's the resident's dirt. So if you give them the call light with your gloves on, you're fine. Because in the final analysis, when you're all done with that resident and take off your gloves, you're going to be wiping your hands or washing your hands, and you're going to be exiting the room. So don't let those things confuse you, okay? So now we're going to do Peri Care. So when you're doing Peri Care, you're going to have 2 towels for the front, 2 towels for the back, your dry towel, soap, and your incontinent pad. Now remember, with catheter care, the incontinent pad was already under the person, but it's not for Peri Care. So I'm gonna just do my hands here and make sure that they are fully dry, really good. And to remember, never walk away from the bed with the bed in high position, okay? Look, my glove kind of tore here, but I got a couple extra pair here, so it's a good thing I grabbed an extra one, huh? So I'm gonna put my gloves on, and then I'm gonna ask Miss Yolanda to step to the other side so that she can help me to turn the client so that I can put the under pad under them. I am going to take my cover and I'm going to kind of fold it back here. And then I'm just going to ask you to hold the shoulder and the hip and to turn. Here, hold that hand so that that hand doesn't fall out. And, all right, here's the incontinent pad. I am going to fold it halfway so that I can push it up under the person. I'm going to turn her back, and then the rest of this I will do. I'm going to turn her and hold her, and then I am going to straighten that pad out. Thank you, Miss Yolanda. So now what I'm going to do is I'm going to only expose the area that I am going to be washing. So I'm just going to take and fix her legs a little bit so that I can really do what I need to do here. Okay, so see the Peri area here. See the Peri area? We're going to be doing the Peri area, and everything we do, we're going to do twice. So I'm going to put this down because you always want to maintain what? Privacy. So I'm going to put some soap on my towel here. And of course, this is a water skill. You always ask the resident to check the water, okay? So now I'm getting ready to do Peri Care. I am going the side of the lip. 1, flip, 2, I'm going to flip my towel again, the other side, 3, flip, 4, flip. I'm going to flip again because now I'm going down the middle. 1, 2. All right, so now I've washed. Now I am going to rinse the area. You notice I'm covering up when I get done, right? I'm going down the side. 1, flip, 2, flip. I'm going to the other side, down, flip, the other side again, flip, because now I'm getting ready to go down the middle, and see how I'm holding my hand so that I can separate the labia and go down, and I'm going to flip again and go down, okay? And I am covering to maintain that privacy, right? I'm opening up my towel, pat dry, do some flipping here, pat dry, do some flipping here, pat dry. And notice that my hands are always here when I'm doing this to pat dry. Now, how many times did we do this? You're going down the side 2 times, one side, then you're going to the other side 2 times, and then you're going down the middle 2 times. So that's a total of 6 times. So now what I need to do is I need to clean the back side. So I'm going to ask Miss Yolanda to help me again. She's going to turn the patient over for me. And I have a whole new set of towels here for the back. I can dispose of those towels because I'm done with those. So now I'm going to wipe. You always go from front to back. You're not going this direction. You're going front to back. So I'm going to wipe front to back. Front to back. How many times did I do that? Twice. And now I'm using my rinse towel. Front to back. Flip, front to back, and I'm always covering up when I'm moving away from the client or resident. Pat dry, front to back. You are not wiping the cheeks. You're just doing the anal area. That's all the state requires. Of course, if we were in the nursing home and we was cleaning somebody and they had urine or BM, then we would clean those areas, okay? But for the state, you don't have to do that. And then I'm taking this incontinent pad and I am taking it out. Thank you, Miss Yolanda. I appreciate that. And now I'm taking this out. This would go in the garbage because I'm done with it. I am straightening my resident out because I've done what I needed to do. I'm going to give her the call light. I am going to put my bed, in its lowest position. My bed is still locked. Sometimes when you look at the skill sheets, it might say give the person the call light and then do this and do that. Again, things are not order dependent. You can take care of your resident. You can hand them the call light with the gloves on. If we was in the nursing home and you were doing things in that resident's room, you're going to take care of that resident. You're going to make sure that they're okay. You're going to give them their call light, and then you're going to begin to empty stuff. So what I'm saying is sometimes you might look at the skill sheet and it may say give the call light, then do this and do that. But I want you to understand they are not order dependent. You just need to know, take care of your resident. You can give them the call light with your gloves on. That's fine. Because in the nursing home, I tell you, when you walk into that nursing home and you go into a patient's room, and you know you have to do something for them, sanitize, put your gloves on, because you don't want to have them just hanging and waiting for you to do stuff and you haven't even put your gloves on. And I hear students say all the time, well, I would never do this and do that without putting on gloves. Guess what? I have seen students get ready to change people and don't put on gloves, and I have to say, gloves, because you forget. Remember those things, and if you remember those things, you will be just fine. Thank you for tuning in, and this is for your benefit. Please watch, enjoy, and practice. Thank you.